This last video I'm going to talk about cracked teeth as far as what can we do for treatment. It really comes down to what is left and how is a tooth broken. And we can divide cracked teeth into two types, basically horizontal and vertical cracks. Horizontal cracks typically occur on the top part, the crown part, corner breaks off or a side breaks off. If it's not too big, we can just basically put a filling there or even extend the existing filling to that area. If a large piece is broken off, and especially if the rest of the tooth is already compromised and structurally weak, you don't want more of it to break, then we need to put something around the tooth to hold it together. And typically that's in the form of a cap or a crown, or also something called an onlay. The important thing is that there be enough tooth structure left for us to be able to put a cap or crown on top of it. And for that to occur, we need to have at least 3 millimeters of tooth structure to fit on top of it. Caps and crowns do not fit on top of each other like a butt joint. They actually have to go around the tooth. So if this is the gum line, this is the tooth, we need to have a few millimeters of tooth that the crown can fit on top of. Sometimes, unfortunately, the crown breaks right at the gum line or even just a tiny bit below, such that there is no tooth structure left to work with. That can still be fixed and saved. What we can do in some cases is shorten the gum and the bone around there, so we now have some tooth sticking above, and now we can go and fix that and restore that. And the only downside of that is the tooth will look longer. If it's in the back, it's maybe not such a big concern, but if it's in the front, where it shows aesthetically when you smell, you don't want the gum height to be higher on one tooth than the next one. It just won't look right. Vertical fractures are unfortunately bad news. There's really nothing that we can do to fix a vertical fracture. Vertical fractures typically occur on the root of the tooth, and so the whole root structure, the foundation of the tooth is cracked, it's gone. There is nothing that we have available that can glue together or mend a fractured root. All you can do is take it out. Sometimes we can buy some time, but it's very little time that we can buy, because as time goes on, it gets lost around that fracture, gets lost around the tooth, it sets up infection, and it can set up bone loss and infection that can even affect the adjacent teeth and affect your options for replacing that fractured tooth. So hopefully these will help a little bit and give you some ideas of what can be done if your tooth is cracked or broken. But really the final diagnosis will come from when going to see a dentist and having him or her take a look at it and see just really what can be done. Thank you.